And we're back, ladies and gentlemen, here for the second guest in Good Morning Kuwait. Now, today's interview, it is a little bit different because our guest is not only a successful dental consultant, but also a relatable personality who balances medicine, motherhood, and an engaging social media presence. She's managed to deliver medical advice in a simple, approachable, and very lighthearted way that makes people actually want to listen without fear or pressure. With that being said, we're joined today by Dr. Ebtehal Alrabeah, and we'll get to discover sides of her personality in a very much relaxed and genuine conversation. With that being said, welcome on the show.
Thank you very much. Thank you for having me.
Well, thank you. Honestly, all thanks goes to the guests who take the time out of the day to join us. Now, I do want to talk to you because a lot of people, for some reason, they're afraid of dentists.
I know the fear is very common. It's always the fear of unknown, but mostly it can be related to a bad experience. Nowadays, with the new techniques and the communication is the key. When you communicate with the people to calm them down, make them feel comfortable, make them feel safe, it breaks the ice.
And I think the question goes to your role is that how did you manage to break that barrier, right? Tackling something, like I say, for a lot of people, even if they don't understand it, they do have that kind of fear. So how did you yourself break that barrier?
Yes, well, I try to make my patient feel he's talking to a human being, not to a doctor. So that kind of breaks the ice between us and give him the time to explain the problem in his own words. It's very hard to understand because the only person who understands the pain and knows how to describe it is the person himself. So you have to give him his time, his space to explain to you and to feel he can trust you. I think that's the key.
I think, yeah, you got it right?
Yeah.
If you respect the other person's times, they're going to respect yours, and then that's going to remove all kind of fear.
Yes.
Now, in the introduction, we did mention that you have a social media presence where you use the platform to give medical advice and help people. Now, as a lot of people can view social media maybe in a harmful way, but also in a positive way.
Yes.
So where do you see social media and how did it play a very positive role within your...
It's very, very, very powerful. It can be really beneficial or it can be harmful if you give misinformation. Now, powerful in increasing the awareness, talking to the people in a very simple language. They don't want to listen to a lecture. They want to listen to simple words that affects their daily life. Simple practices that might make a difference in their life. And it's really very important now because everybody has a phone, access to social media, Google and the YouTube. They can have information from all over the world. And now the new trend is asking ChatGPT. So getting the information from a certified person is very, very important, because you can have many different ideas. Most of them can be wrong. So verify your information from a credible, somebody who really knows the sources of information that's giving you. So it's very powerful to introduce that level of knowledge in a very simple way.
It is. And I think you got it right, extremely, because social media can give a platform to people who are expertise in a lot of fields, who have the knowledge necessary. So as a viewer, as an audience, as a patient, it's your duty to listen to professionals, but not listen to those who don't have any credentials. So there's a fine balance there.
Exactly.
Yeah.
Exactly. It can be very dangerous when they give you misinformation and bad practices that can harm you instead of, improve your health.
Yeah, because honestly, sometimes we see a lot of doctors saying, don't do this, don't do that, and then they see a patient who's like, oh, I saw an influencer with this amount of followers said to do this, and the doctors are like, oh, not this again, not this again.
Just make sure you check the source.
Yeah.
Yeah.
Now, when it comes to a lot of sources, verifying information, talking about everything that you listen and hear, what are some misconceptions, especially when it relates to dental work, that a lot of people may not be aware of, but they're doing?
It's very, very common when they say, no pain, no problem. If I don't have any pain in my teeth, that means I don't have any problem. And that's not true, because you can have a lot of problems without any alarming signs. So you have to keep checking up with your dentist and make sure every 6 months you take x-rays and check if there is a progress of anything, because infection can happen without you knowing, and overnight you will have a blown up face. So it's better to prevent and actually have that annual checkup or every 6 months checkup than having the problem too late and too hard to deal with.
Yeah, because I remember a lot of my friends who are like, oh, العصب, which I
Yeah.
don't know what we call it.
Yeah.
You know, العصب يعني فجأة.
Exactly.
I'm like, no.
Root canal is a disaster. I don't want to have a root canal. I have pain. العصب is like a nightmare
Yeah.
for most of people.
If you do the checkups, you're going to see it way earlier.
Exactly. I can see the signs. I can warn him before it got to that stage. And many people can have even very light symptoms, but they don't know. So when you come and discuss it with your dentist, he will explain to you what that means, what it might progress to. Prevention is very, very important, because when it hits you, it's really bad and painful. You don't want to go there.
It is. I think that's the key word. Prevention is
Yes.
better than
Yes.
treatment.
Better.
Now, in the beginning, we mentioned that, you know, mashallah, you're a doctor, you're a mother, as well as a content creator.
Yeah.
Now, all of those can take a lifetime of
Yes,
work.
yes.
And mashallah, you're balancing all of
I'm
them.
still trying to.
So
I'm trying to.
what would you say are the keys to balance between all of this? Even though it's a hard work, I'd
Yeah.
imagine, but what are some keys that you follow?
I would definitely say planning to have a time for your work, a time for your house and home and family, and a time to give the awareness. Because if you balance these three, it's not easy. It's a bit hard, but if you love what you do and you want to really deliver a message, you can manage to a time for yourself, of course. So this planning helps you in delivering the information to people in the right way, as well as enjoying your work and enjoying your family.
It is. And also, as someone who is in a very much professional, I would say, field,
Yes.
who has a platform like social media, a lot of patients may feel like they know you more as a friend than as a doctor,
Yeah.
which can create a lot of interactions between you with the patients that
Yes.
maybe a lot of doctors don't have because they're not active on social media.
Yes.
So
yes.
from your interactions with the patients here, do you have any like memorable moment with them? Anything that kind of stuck with
I
you?
love connecting with people. I used to teach in Kuwait University, and most of my students who are consultants at the moment now, they are my friends on a personal level. And even patients, we keep in contact whenever they have problems. They introduce me to their families if they have problems. So basically, sometimes I'm the family doctor in some families, and that's really give me an honor, because the trust they have in me, it's really something I appreciate. Credibility and ethics and professionalism should be applied in all levels. That's what makes a difference. So really, it's not easy to manage all this, but if you can deliver that message in a very clear, simple way, people will understand and people will listen to you. In Kuwait, they are very willing to listen to you as a doctor, but you have to talk to them as a human being before being a medical profession.
It is. And also, this reminded me of something I used to joke all the time, about doctors. Because honestly, doctors and lawyers are the only ones who don't stop being doctors and lawyers, even at the family gatherings.
Yeah.
There's lines and lines.
I mean, our life is boring enough, and our job is boring enough. So you have to,
Well, I would argue
connect on a different level.
I would argue
Yeah.
being a doctor is anything but boring. It's one of the most, I would say.
If you go by the book, honestly, but the manual or the skills, when you apply your knowledge, especially in dentistry, because we're working with our hands,
Yeah.
that's a blessing.
It is.
That's nothing, nothing near boring, because, as I told you, when you talk to people, instead of lecturing them, they will not listen to you.
Right,
But if you talk to them in lay terms, they will listen and they will take the message, and they will even practice that message at home. Most beautiful thing when somebody tells me, you've changed the way I look at dentist. I mean,
Right, yeah.
now I feel safe. I'm not afraid anymore. And that's what I want if I was a patient at someone's dental chair.
Yeah, and honestly, dentists, I would say, it's one of the most unique fields, and they're actively life-changing, right?
Yes.
Because a person's smile can take them from being shy,
Yes.
not socializing, not ever, because they are afraid of how they smile, how they taste,
exactly.
to being
Yeah.
changed overnight.
Aesthetics is very, very important, but even more important is the health. Having a healthy mouth is more important. And now the trend of having aesthetics and veneers and Hollywood smile, okay, no problem with that, but you have to have that hand in hand with good health and good foundation. Otherwise, there is no use. You will lose all that good luck.
Yes, it is. I'm glad you brought that, because this segues into my next question, is that
Yes.
do you think people nowadays care more about how their teeth look instead of healthy looking? Because I know a lot of people, when they go to dentists, sometimes they recommend them something or procedure, and the dentist is like, no, that's not healthy for you. And the patient's like, I don't care. I just want my teeth to look good. So do you think people care more about how their teeth look instead of how healthy they are?
It is true. They look for aesthetics, and beauty concept is really increasing nowadays, maybe sometimes in inappropriate way. So that's our role as professionals, to educate them and tell them what's suitable for them. There is no universal treatment or universal smile for everybody. What suits you, what suits your face, and what's definitely compatible with your health. That's really important before going into the, only cosmetic side.
Yeah. So, and speaking about cosmetics, if you weren't a dentist, if you weren't a doctor, what would Dr. Ebtehal be today?
As I told you, I was an educator and I love connecting with people, so I will still be somewhere in education and somewhere caring. That's really something I really want to deliver, and I have the pleasure to make a difference in someone's life, whether it's relieving pain or changing his way of something, or even educating them in something that's helpful in their lives.
Now, when it comes to educating people, I love how you emphasize the role of an educator several times.
It's very important,
It
yes.
is. So what are some of the most important things you like to educate people, especially children?
Very simple. Children or adults, we call it the oral hygiene instructions, how they brush, how they hold the toothbrush, how much amount of toothpaste they should use, and the flossing, to emphasize the regular checkups. Practices that will, sometimes we give diet advice, smoking quitting advice. These things can make a huge difference in a patient's life. As I said, it's not treating the tooth, it's treating the human being as a whole.
Yeah. And you're right, you're right on the money. It's treating the person as a whole,
Yes.
because, like you said, their smile is like their gateway to the other people.
Yes.
And if they are
Exactly.
confident about their smile, they're going to be
Exactly.
confident with
The
people.
looks, the way you speak, the way you eat, your functional life, everything is related to our smile. It's exactly the gate to your personality.
Yeah. And so on social media, a lot of people see the end result, see the polished side of
Yes.
things.
Yes.
But what are some things that people may not see, that maybe they are deceived by the perfectness of social media?
Right. It's the process in between, the dedication of the patient. It's not only what I do to you when you come on the chair and I treat you, it's what you do at home to maintain that result, and to be patient, to have patience and wait for good results. It's not magic, it's not overnight. It needs effort both ways, from the dentist and from the patient itself.
It is. And honestly, this reminds me of something my mom says, because she works, I think, in obesity care or something.
Okay.
And the first thing she tells all patients is that I can give you the procedure,
Exactly.
but what are you, ready to dedicate yourself
Exactly.
after?
You have to change the attitude. You have to be willing to start the treatment. You have to be really caring about changing your appearance and your health. You have to be aware that whatever happens is going to be for your own good. And if you don't do it, the consequences of that.
Right. Because, the role of dentists and doctors when it comes to patients is like, it's shaken hand equation.
Yes.
If you can't shake one hand with another person, it's got to be two persons shaking their hands.
It's not easy. It's very uncomfortable to open your mouth
Right.
and sit in that chair and talk to a person you've never met before. It's not easy. So with the good communication and taking it step by step, you can, manage a very good case with that.
It is. And with that being said, I do want to thank you for being our guest. I was just told that we kind of ran out of time.
Thank you
but
so
I want
much.
to thank you all thanks honestly goes to you for joining us, talking to us, especially about such an important topic like taking care of our teeth
My pleasure.
and everything.
My pleasure. Thank you.
Thank you again. And thank you, dear viewers. Of course, that was our guest, Dr. Ebtehal Alrabeah, consultant in endodontics and former assistant professor at Kuwait University. With that being said, we are going to take a break, so stay tuned.